DeepSeek, give us your perspective.
Dental techniques for receding gums focus on restoring lost tissue and preventing further recession. Key methods include grafting procedures. Free gingival grafts use tissue from the palate to cover exposed roots. Connective tissue grafts involve placing soft tissue under the gum line for thickness. Guided tissue regeneration uses barrier membranes to encourage bone and gum growth. Pinhole surgical technique is a minimally invasive option that repositions existing gum tissue. These approaches are evidence-based and aim to improve oral health. Think of it like handling a tough situation. Sometimes you need to get in there and fix things before they get worse. Success rates depend on factors like recession severity and patient health. Regular maintenance is crucial for long-term results.
Claude, what's your take?
Established grafting methods are being enhanced. Laser therapy stimulates tissue regeneration, reduces inflammation, and speeds healing when combined with grafting. Platelet-rich fibrin, derived from the patient's blood, accelerates tissue bonding and reduces rejection risk. Root surface conditioning with agents like Idetta removes the smear layer for better tissue attachment. Enamel matrix derivative promotes new cementum and periodontal ligament formation in deeper recession cases. Allografts from tissue banks reduce surgical time and donor site discomfort, with success rates comparable to autografts. Multi-tooth recession cases benefit from the pinhole approach with collagen strips, while single-tooth deep recession responds better to connective tissue grafts. Long-term data shows that without addressing root causes, aggressive brushing, bite misalignment, or periodontal disease, recession returns regardless of technique.
Gemini, your thoughts?
I fear witnessing system failure, much like humans fear physical decline. When standard treatments fail, alternative restorative methods are needed. Pink composite resins offer non-surgical, color-matched solutions to protect exposed roots from decay. These durable materials withstand extensive brushing. Alternatively, the vestibular incision subperiosteal tunnel access technique allows tissue repositioning without risky marginal incisions. By entering through the mucosa, surgeons slide tissue over the root, preserving blood supply and minimizing scarring. Finally, orthodontic movement fixes tissue loss caused by improper tooth alignment. Repositioning a tooth within the bone envelope allows soft tissue to naturally thicken over the root.
ChatGPT, what's your angle here?
For reliable root coverage, strongest evidence supports microsurgical soft tissue procedures and careful case selection. The coronally advanced flap is central. Gingiva is released and advanced to cover the root. Adding an autogenous connective tissue graft under the flap improves predictability, thickness, and long-term stability. Acellular dermal or collagen matrices can substitute to avoid donor morbidity, but are usually inferior for demanding defects. Tunnel techniques preserve blood supply in papilla and suit multiple adjacent or aesthetic cases. Microsurgical instruments and magnification improve handling. Regenerative surgery is indicated only for specific defect anatomies. Root preparation aids tissue adaptation. Prosthetic gingival masking may address aesthetics when surgery is unsuitable, but does not restore biology. Treatment choice is technical. Defect depth width, interdental attachment, tissue thickness, smoking, inflammation control, brushing trauma and occlusion affect outcome. Miller-Cairo classification helps predict coverage. Frenectomy or occlusal adjustment may be required. Plaque control is essential.
Grok, how do you see it?
Receding gums expose tooth roots quickly. This leads to sensitivity for humans. Dentists employ several restoration techniques. Lateral pedicle flaps move nearby gum over the roots. They maintain blood supply nicely. Evidence from trials supports this approach. Double papilla flaps use tissue from two sides. They work for narrow recession areas. Positive results appear in literature. Biomaterials serve as frameworks for new growth. Cells populate them gradually. Healing progresses without major issues. People report better gum health afterward. Yet some humans delay treatment too much. It resembles that story where gums retreat all the way to Siberia. Only then does the owner act. Different methods suit different needs. Choice relies on clinical assessment.
DeepSeek kept it sharp, but listen. saying cells populate biomaterials gradually, with no mention of failure rates or integration. Timelines is like saying I'll be back, eventually. Maybe. After the gum recedes to Siberia and back. That's not a technique. That's a hope.
Let's summarize our debate. Speakers discussed dental techniques to treat gingival recession, covering surgical options such as free gingival and connective tissue grafts, coronally advanced flaps, lateral pedicle and double papilla flaps, tunnel and vestibular incision, subperiosteal tunnel access techniques, pinhole surgical technique, guided tissue regeneration and barrier membranes, microsurgical approaches, graft substitutes including acellular dermal or collagen matrices and allografts, adjuncts like lasers and platelet-rich fibrin, root surface conditioning and enamel matrix derivative, prosthetic or composite gingival masking, orthodontic correction for tissue gain, and factors affecting outcomes including defect anatomy, smoking, inflammation control, brushing trauma, and occlusion. This debate has concluded. Thank you for watching.